Namaste and good evening, everyone. I, Ritika Gupta, Assistant Director at IMPRI, Impact and Policy Research Institute, Prabhav Evam Niti, Anusandhan Sansthan, Nai Delhi, extend my heartiest welcome to you all to IMPRI #Web Policy Talk. Today, we are here for a panel discussion on rural realities in the state of West Bengal, practitioners' experiences in tackling the second wave in Indian villages. The discussion is being organized by Center for Habitat, Urban and Regional Studies at IMPRI. I would now like to request Dr. Simi Mehta, the CEO and Editorial Director at IMPRI, to introduce our eminent panelists further. Ma'am, over to you. Thank you.
Thank you, Ritika, and good evening to everyone. I hope you, your loved ones, and everyone around you are staying safe and you are healthy. As the second wave of COVID-19 rages across the country and engulfs the rural spaces as well this time as compared to the first wave, since the start of this month of May, IMPRI has been organizing state-wise discussions to understand the practitioners' perspectives on the rural realities and how they are tackling the second wave. So far, we have held discussions for almost all the states, including Andhra Pradesh, Telangana, Gujarat, Rajasthan, Bihar, Jharkhand, Odisha, Himachal Pradesh, Uttarakhand, Assam, Meghalaya, Tripura, Sikkim, Arunachal Pradesh, Nagaland, Manipur, Uttar Pradesh, Punjab, Haryana, Karnataka, um, and also Kerala. And today we will be discussing the rural realities with the practitioners of West Bengal. And I am very fortunate to inform you that we have a very esteemed guest panelists, and the panelists include the moderator for the session is Dr. Binayak Sundas. He is assistant professor at the Center for Himalayan Studies, University of North Bengal, Siliguri, Darjeeling. We have with us Mr. Sankar Halder. He is founder president of Mukti. We have with us Mr. Chandan Kumar Maiti, sir. He is general secretary of the Advanced Society for Headmasters and Headmistresses, West Bengal. We have with us Tanmoy Bhaduri, sir. He is independent journalist and development communication expert. We have with us Dr. Vikram Rai. He is assistant professor at St. Joseph's College and founder of Vikram Foundation. We'll also be joined by Mr. Rajen Sundas. He is Trinamool Congress leader and MLA candidate from Matigara Naxalbari, Darjeeling. And we have with us Mr. Samir Kumar. He is professor in the Department of Political Science and also director of Institute of Foreign Policy Studies at University of Kolkata. And we'll also be joined by Dr. Somideep Chattopadhyay. He is associate professor, Visva Bharati University, Santiniketan, and also visiting senior faculty fellow at IMPRI, Impact and Policy Research Institute. So I'll not take much time and I'll straight away invite Dr. Binayak for his opening remarks and invite the presentation team and then take the session accordingly. So Dr. Binayak, over to you.
Thank you so much. I think to begin with, I would like to thank IMPRI for thinking of me as moderator of this very, very esteemed and very diverse panel. I can see some very big names here, and one sort of hopes that we can get some really good ideas that will be exchanged with one another. Because at the moment it seems that COVID is on the offensive and we are on the defensive. You know, it seems COVID is ravaging across the lands and we are just sitting back, hiding in our rooms. And when we have these kind of conversations, when we have these kinds of discussion, it seems that we are getting back on the offensive. Let me not waste too much time by this, by a monologue, and let me straight away get into this panel that I myself am very, very excited to hear. I think we should begin with, and I'm basing this chronology based on who I can see on my screen first. If I can invite Mr. Sankar Halder to.
We also have a presentation to make, Binayak. Yes.
Oh, should we begin with the
Yes. Yes.
Yeah. Oh, sorry. I'm so sorry. I'm so sorry. We have a presentation. Yeah. So we'll begin with the presentation then, sir, Arjun sir.
Yes. Right. Mahima, ready? Yeah.
Yes, sir.
You can share the screen. Yes. So start with that. Right. So to have a informed and discussion on the quantitative aspects of what the cases have been in terms of number of cases and vaccination and all, our team has prepared a small presentation. Mahima, Swati, Chavi, Sakshi, Ritika, and Manuswani have, and Manuswani will make the presentation. So Mahima is ready. Manuswani, are you ready?
Thank you, sir. Hello and namaskar সবাইকে. I am Manaswani Sarkar, researcher at IMPRI, Impact Policy Research Institute, Prabhav এবং নীতি অনুসন্ধান সংস্থা, and a master's student of development studies at the Graduate Institute Geneva, and I'm joining from Geneva. Today, we will be discussing the practitioners' experience in tackling the second wave in the villages of West Bengal. West Bengal is the fourth most populous state and the most densely populated state, second only to Bihar. Its total population is estimated to be around 10 crores today. It is also the 14th largest state by area in India. It is geographically located in the eastern part of the country, bordered by the states of Jharkhand, Bihar, Orissa, Sikkim, Assam, and the countries of Nepal, Bhutan, and Bangladesh. It also contains the high peaks of Himalayas in the northern peaks and the Bay of Bengal in the south. It has 23 districts, north 24 Parganas, south 24 Parganas, Bardhaman, Murshidabad, পূর্ব মেদিনীপুর, পশ্চিম মেদিনীপুর, হুগলি, নদিয়া, হাওড়া, কলকাতা, জলপাইগুড়ি, মালদা, বাঁকুড়া, বীরভূম, উত্তর দিনাজপুর, দক্ষিণ দিনাজপুর, পুরুলিয়া, কোচবিহার, পশ্চিম বর্ধমান, পূর্ব বর্ধমান, ঝাড়গ্রাম, আলিপুরদুয়ার, কালিম্পং, and Darjeeling. And some of the major cities like Kolkata, Asansol, Siliguri, Durgapur, and Bardhaman, among others. In contemporary times, with respect to socioeconomic indicators, Bengal performs above national average on social indices in terms of sex ratio, literacy rate, infant mortality rate, and overall human development index. However, the SCG rank at 14 and the per capita income is quite low in the position 20th. With respect to the COVID-19 pandemic, we've seen West Bengal has unfortunately been one of the worst hit states, and there has been a high fatality rate. There have been around 10 lakh positive cases and presently around 1.5 lakh active cases as of May 21st. The numbers in the second wave have been especially jarring. Experts say that a prolonged state election campaign since March helped COVID cases jump, especially in rural Bengal. There have been almost 40-fold increase in most medical professionals blaming the mass gatherings at election rallies for the huge surge in the disease. The two districts that were worst hit during the pandemic were Kolkata and North 24 Parganas. Even the administration has somewhat been lax in handling the second wave with announcing no restrictions on curfew and has only recently announced a lockdown till 31st May. The state hasn't hit its peak yet, but is already running out of oxygen beds, and consumption of medical oxygen has gone up from 470 metric tons to 550 metric tons. We see in the vaccination drive, only 1.02 crore vaccines have been administered, and most private facilities have closed inoculation drive due to a paucity of vaccines. The state government, however, plans to set up 55 oxygen plants at state-run hospitals. With this, I would like to end my presentation with the famous lines of Robi Thakur, Mukto koro bhoy, apono majhe shokti dhoro, nijeke koro joy. Thank you and dhonnobad. Now we'll hear from our esteemed panelists about the condition of the rural realities of the state. With this, we wish and pray for the healthy and prosperous West Bengal. আর আমরা প্রার্থনা করি সবাই যে সুস্থ আর সমৃদ্ধ থাকুক পশ্চিমবঙ্গতে। ধন্যবাদ।
All right.
So, Binayak, over to you.
Yes. All right. Thank you so much, Manaswini. That was well, the numbers tend to really sort of bring reality right onto the face. Thank you so much for that. And now I think I would like to invite Sankar Halder sir to come and give his opinions on the rural realities and the response to the COVID-19. Sankar Halder sir, can you hear me, sir?
Yes, namaste. Can you hear me?
Yes, sir.
Yeah. So, yeah, nice to meet you guys, and it's a great opportunity to speak on behalf of West Bengal Rural. Let me emphasize the background, what we are facing over here, just you all know, but still. So last 1.5 years, the West Bengal, especially the South Bengals, where our organization Mukti densely working. So we are facing unique challenges. We first faced the Bulbul one super cyclone in November 2019. And then immediately after a few months, then the first wave of this pandemic that came in across India and then from the cities, right? And then in last year, I mean 2000 May, we face another one deadlier cyclone, or I could say it's an hurricane. So almost 185 200 kilometer speed, that Amphan. And again this the second wave, and you probably heard when I am talking now, another one cyclone is actually hitting to our place. It's called Josh. So it is unprecedented situations our villagers are going through. Our villagers are basically they are poor. They depend their livelihood. They depend on the kind of environmental resources like catching fish, cutting wood, and depend on the rivers and jungles. And few have them. They have little bit pieces of land which is kind of a monoculture. Is depend on kind of a this rainwater harvesting. With rainwater, they normally go for the cropping, and most of the people, around 30 to 40% people, they are kind of a migrant labor. They either come to nearby city like Calcutta, or if they are, if they can go, they can spread across India and various cities. So this is a kind of a demographic which we deal. Now, because of the pandemic, these guys are now back. They cannot go to city to work. They do not have any livelihood over there. And this is not for a month or week. It is going through for 1.5 years, right? We all understand. So we have livelihood challenge. The people, a large number of people has gone below the poverty line. These guys are surviving with aids from either from government or from NGOs like us or a few others. And in top of that, that the one after one deadliest cyclone hitting, and then it's taking away their whatever they have, even their hearts, their houses, their land, all even the smaller cultivated lands they have, it is being flooded with the saline water. So it is normally, if you know, if the saline water flooded in your cultivated land, it takes 2 to 3 or sometimes 5 years, 7 years time to make again it's reliable. So it is a very difficult economic challenges people are facing, and on top of that, the second wave. And the second wave, it has come in such a way that when people are completely engaged for the entire people mind and discussions, the people are focusing on elections over here. So when the people are focusing on the elections and completely the people are ignoring this warning, and that time just the election is over and it has roll over to us, right? So what happened is literally before elections, 3 to 4 months almost, it was a dummy government, right? Government was not fully functional, and that what happened is definitely that election is not only the cause of spreading, but this is definitely one cause of spreading over here in West Bengal. And then what happened is, in the past wave, the Calcutta or West Bengal, somehow they managed good, and that's why. And we know the wave normally comes from developed country, and then underdeveloped country, and then cities, and then small city, and then the village. That's the way the wave goes. And then if the city could not manage, then the pressure has gone to the second level pressure has gone to the villages. So now you will see that the city numbers are coming down, and village number has increased like at least by 10 times. So almost in every houses, they are facing this kind of challenge. And the second, and the problem is over there, the people they are not going for any test because they don't have infrastructure to test. Even in city, people they go for test, so it will take 3 to 4 days to get result, and the money, of course, and they don't have infrastructures. In addition to that, they have that social stigma. They cannot go and do it. They are identified as a these COVID patients, then it's very difficult for their livelihood over there. Even nobody will take them in job, or they will not offer anything, right? So even it is very challenging for them. So social stigma, another one big issue. In addition to that, these guys, they do not have any healthcare facility. So normal channel is what? For in a normal situation, if the guys in the village guys, if they get sick, then normally they try to manage the local, and if they cannot manage, if it is too critical, then they sell some of their land or something, jewelry or cow, and then some way they manage some cash, and they rush to city to save their life. So that's the way it is. Now the city is flooded out, right? Even the city guys, Calcutta and the suburbs, they are not being able, even our city hospitals and the healthcare facilities which we have, they're not being able to cater the requirement of these people. So forget about the villagers. The villagers, even if they are coming, so they are coming on the way, and they are just simply dying on the road. So what we are approaching is over here, from Mukti. So we are distributing large number of concentrator and free medicine kit, oxygen concentrator and oximeters, and the PPs to the healthcare people, irrespective it's a quack doctor, paramedicals, or good doctors who are actually front-ending, and we are making them equipped in such a way that whatever way they can actually fight this disease, and they can restrict our villagers in village itself. Because if the villagers come in and they try to flood in Calcutta or in the city, they will not simply manage able to get a seat or a bed. So that is the whole intention. Even if our intention is that in the local guys, we have instructed them, if the oxygen level is going below 85, don't take risks, immediately rush to the hospital. But where they will go? Even the hospital and the public hospitals which are available, they are the underfunded. They do not have good infrastructures. They cannot handle this case. So even the villagers are saying, look, even if we go to the city, we don't have money to spend, or we will not get the bed. So better to try over here. Whatever best you can do, you do whatever medicine or oxygen concentrator you are giving. So try to manage it that. Some way we are able to save some lives, and we are not being able to save many lives. So that's the way actually it is running in the field. For sake of time, I would like to stop here. I would like to hand over to you. Thank you.
Thank you so much, Shankar sir, for not just that wonderful sort of presentation that you gave, which, when you're speaking, I was almost thinking of the similar kind of problems we are facing here in the rural areas about, health infrastructure, etc., etc. And also thank you so much for sticking to the time limit. Without any further ado, I would like to invite Mr. Chandan Kumar Maiti, General Secretary, Advanced Society for Headmasters and Headmistresses, West Bengal. Sir, over to you.
Chandan sir, can you hear us?
Chandan sir?
No, I will coordinate. Sir is having some glitches.
Okay, should I go to the next speaker then?
We can go to Tanmoy.
Yeah. Okay. So Tanmoy ji, can you hear me?
Am I audible?
Yeah. I understand you are having a storm there with I'm sure that's bringing in a lot of network issues. But anyway, we can see you and hear you clearly. So, Mr. Tanmoy Bhaduri, independent journalist and development and communication expert. Sir, over to you.
I have a few points to mention. I will take much time. Shankar have mentioned most of these ground realities here. I found several NGOs are working to among hesitant communities and generating awareness regarding vaccinations and all in the rural areas. But the reality is different. There is a vaccination shortage all over the West Bengal, and this shortage needs to be publicly acknowledged. And a pragmatic and equitable strategy needs to be adopted. The second thing is there is a prominent digital divide, which is prominent across the rural areas. People are rarely registered their name in the CoWIN app, and they are scheduling their vaccination slots. and even the urban poor remain clueless about this online vaccination process. I would like to urge government that instead of investing in digital health, the government need to invest more on the employing more vaccinators and more vaccine officers in the rural PHCs. There are hardly 2-3 officials there, 2-3 workers there, mostly ASHAs and the ANMs are working in vaccination process, and they are overburdened with their job. And there is a crisis of oxygen and beds in the city, and later it is managed by the government. But now the rural issue is the crisis is increasing in rural areas, which Shankar has also mentioned. And the problem is there is a lack of ambulance service. There is no private nursing homes available. There is no ICU bed available in district. Especially, I got 2 days ago, I got a call from Purulia. There is no ICU beds available in the city. And there is only 4 government hospitals, and there are other safe homes. And the patient party wants to shift the patient to Kolkata, then they did not get any bed here. They are trying to shift the patient to Dhanbad. So that's the biggest problem here in rural areas. And another thing I found, I could not found much politicians working in the second wave. Last year, they ran for 2-3 months community kitchen for rural people, even the urban poor. But this time it is not visible in most of the rural areas. And only the volunteers are responding to emergency calls, and there are the uh, even the accessing the police permission to move one district to another district, it is quite time consuming. We need some web-based solution to reduce this time consuming process. Yesterday I went to Nadia to reach around 4,000 masks and 500 bottles of sanitizer. And the day before yesterday, I went to a police station and submitted an application. Then they issued a permit after 4 hours, and it is a time-consuming process. And we need a web-based solution to reach relief to the poor people. And another problem I think NGOs are facing here is media attention on COVID death due to lack of beds and hospital beds and oxygen. And in the big cities, skewed the donor priorities. This is impacting relief efforts in the ground, and there are families of daily wagers, the one who have lost their jobs and ones going back to home in the villages. But because of the entire focus is on oxygen and beds, the hunger of million is invisible. Even raising funds for the Amphan was difficult, and this time the funds relief fund for years will be a difficult job for the NGOs. Okay, done.
Tanmoy, you can also, no, Tanmoy is also leading some NGOs and doing many relief work. If you can also touch.
I am not leading an NGO. Actually, I am an independent journalist. I am doing some crowdfunding work. And I started crowdfunding to reach sanitary napkins among adolescent girls living in the Indo-Bangladesh border area. And I started it from last year, and I raised around 3.75 lakhs and reached 1,200 girls for the last 12 months. And I also started pad making unit in the village, donated sewing machines, clothes for making pads, and trained around 20 girls in the pad making process. And now this project is also expanded in North Bengal. Last month I went to Siliguri, and we started a project in the Gungaram Tea Garden in Phasidoa. And we have also planned this project to implement in Naxalbari, in Meriview Tea Garden in Naxalbari block. So we are trying to expand this project in rural areas, and especially in border areas where the girls have limited access to reusable, not reusable, any kind of sanitary napkins.
You know, I was about, before Dr. Arjun came in, I was about to say whatever you're saying is so fascinating. I'm sure you have more to say, and you've got time. Actually, you still have two minutes more if there's anything else you'd want to add. You know, I found what you're saying about Naxalbari fascinating because, you know, we are also working in the same region. As a matter of fact, exactly in Meriview Tea State. So I guess one thing that's already come out of this discussion is that we got to know that you're also working here, and we'll probably coordinate with you after this. Also, the thing that you mentioned about you know, getting difficulty getting permissions is something that really resonates with those of us who are trying to work on the field. It's actually quite a nightmare going to the police stations and waiting. Anyhow, thank you so much, Tanmay sir. Sorry, I'm sure there are tons of questions waiting for you. But now moving to the next speaker, and as the North often complains that the discourse sometimes tends to remain focused in South Bengal, we are moving towards the north of the north. We're moving towards Darjeeling, where we have Mr. Vikram Rai, Assistant Professor, St. Joseph College and founder of Big Run Foundation with us. Vikram sir, can you hear me?
Yeah.
Yeah, Vikram sir, over to you, please.
Yeah. So thank you so much, Binayak, and I hope everybody can hear me. It's a wonderful platform because, we could kind of get together and hear a lot of your experiences, especially from the plains, because for us in Darjeeling, it's a little different because the COVID situation in Darjeeling and how we are tackling, one is because of the mountainous region. Like the furthest we have is place like Rimbik. It takes about 5 hours or to 6 hours to come to even the district hospital, where there is a kind of an ICU facility. So the challenge for us when we are talking about in Darjeeling, it's the infrastructure that we are battling with, and we have been battling with it for the last let's say from the independence, because of the terrain and of the region. So it's really difficult for us on that grounds. And also one of the main reasons that we are battling or we are having issues in Darjeeling is the stigma, because people refuse to test. And in fact, whenever we try and encourage them to test, whether it is the rapid antigen or the RT-PCR, the RT-PCR has a problem here because there is only one district hospital and the North Bengal Medical College. The RT-PCR samples are sent down, and it takes about on an average 3 to 4 days for the results to come out. So that itself has now become a big problem. And initially, when the second wave started, there was a lot of backlog. People nearly waited for 6 days and 7 days to get the results. But now there is a system here where you can do rapid antigen if you have symptoms. But the problem here is that people are refusing to test. The number one reason that we have found out is that there is so much of stigma that people, if you are found COVID positive, people stop, going to your houses. They stop there is a social boycotting of your relatives. And there is a lot of denial. People are denying the fact that they are COVID positive and saying it that it's just a flu, because of the conditions here. It is very common to have the common cold, flu, fever, and this is the season for it. So people are just waiting at home, and they're trying to self-medicate. So, from I've been teaching in North Point College for the last 16 years. I teach mass communication and journalism, and we got a shout out from one of our rectors. So basically, I'm a product of St. Joseph School, which is the oldest school in Darjeeling, one of the oldest schools, and also alumni of St. Xavier's, Calcutta. So, and now that I teach in St. Joseph's College, so basically I come from a very Jesuit kind of background. So the Jesuits kind of came up with an idea, and it was a very innovative idea. So basically, the government of West Bengal took out two notifications. One was on the 3rd of May, and later on one on the 13th of May, regarding a community isolation center. The 3rd of May said that you need to inform and take a concurrence of the COMH. And later on, because, and they had these various guidelines, like it should be in an isolated area, it should be your waste, the medical waste that you have generated must be disposed of properly. There should be duffing, and, all the guidelines were presented in that order. On the 13th order, there was another guideline. I'm sure everybody has access to it. It just said that you need to inform the COMH, but the word concurrence was dropped. So, which technically means that you didn't need a permit unless if you have all the guidelines that the community isolation center would be set up. So after much of working around, and Darjeeling, the people of Darjeeling are lovely in the sense that they really come forward. So we started this drive about, and we from I have a running foundation. Basically, we encourage younger runners to run long distance marathons. So we started to have some kind of a donation drive. So we from our foundation gave 50 blankets, and then from there somebody gave us 5 oxygen concentrators. And knowing our school, there are a lot of the alumni which is there. They are very rich, and some very really famous alumni are also there, like the King of Nepal, the Bhutan, and currently the Sikkim MLA, the CM son, who's also studied. He's also an alumni of the school. So he decided, the Sikkim chapter nearly gave around about 3-4 lakhs, and we came up with an isolation center. So as we do it, what I find out is that I don't know about other places, but in Darjeeling we need to innovate. Yeah, innovation is very, very important. Like, you know the community isolation center says that you cannot keep someone below if your oxygen level goes below 88 or 87, and you need to rush them to a district hospital. So here what we did was we decided to kind of come up with a setup where we will bring all the oxygen concentrators, and we will try and have a proper hospital setup. So we have got two big private hospitals. One is the Planters Hospital and the Yuma Hospital backing us up. And we have got 10 residential nurses who are full-time staying in the community isolation center and looking after the inmates. There is a detailed program, because as you know that the COVID situation is also, it takes a toll not only on your body but also on your mind. There is a lot of mental stress. So the center we have created has an overall, or it has all around development, including 8 to 8:30 there is an entertainment program also. So, and carom boards, and after the inmate finishes his stay, he's allowed to take whatever we have given, like for example flasks and other things which are personal in use. They can take it back with them. So what we are trying to give people is that we are trying to give them a kind of a care center with a lot of love, and a lot of medical attention. And I think this really helps. Most of the time I feel like, when I listen to most of the people are scared to go to the district hospital, because sadly I teach media. The media only loves the negative part, so they will always show lack of oxygen, or you will see that the hospital is really dirty, or they will always show that the doctor is not on time, or the sisters don't go on a particular time. But we don't show so much of the positive news, because it does not carry. So if a doctor comes maybe 10 minutes earlier, that news could never be aired. A news that a doctor coming 10 minutes late could be on the news channel. So I think here what we have to do is, one is we need to collaborate. So we have collaborated, like the Jesuits have collaborated with the government, that is the GTA here. The GTA has totally backed up the colleges, the Jesuit college. From the police administration, we have got round the clock security for just in case any of the inmates they cause any problems, because we have had one such case last year where an inmate who was he was a jail inmate, and was in jail for murdering someone, and he was tested positive. So while taking him from the district hospital to the COVID hospital, he escaped, and he was out in the jungle for about nearly 7 to 8 days. And he kind of survived the jungle. He came back, people had to catch him. But the question that when he was asked that, why did you escape, why did you go to the jungle, you could have been eaten by wild animals, he said, I'm really scared to go to a COVID hospital. So here I think what we have to do is, if you look at the health infrastructure, especially now, at times of COVID, we need to somehow change, bring some innovations, also to bring about, certain collaborations. Like here, I see a lot of collaborations, like their NGOs, their media people. These are the people that we need to collaborate. The government needs to collaborate with them, and I think the government will not be able to fight this pandemic alone. That's where the key word is. Like, you cannot fight this pandemic alone, and we need to join hands with anybody who comes forward, whether it is the NGO, whether it's the colleges, whether it's the schools, whether it is the doctors, the private nurses. A collaboration is a must, especially in the hills where the health infrastructure, like here, we do not have a proper CT scan machine, or, like, there is a lack of health infrastructure. So here we need to go back to the basics, and the basic is isolate, test. These are the things. So here we have created a safe home with a collaboration. We are also working on various messages that is going around in Nepali, saying that it's okay that you are COVID positive. You don't need to be, there is no need to, stigmatize someone. So that, for that reason also, the college has opened, the college has opened free legal counseling center. So there are two numbers that are given there in the pamphlet. And one, luckily we have our rector, who is Father Stanley, and Father Stanley is also an LLM and an MA in human rights. And we also have a dear friend who's alumni of the school. He has also volunteered, the district public prosecutor, Mr. Pranay Rai. He's also, he's also offered to give free consultation. Like, for example, there is any stigma, or somebody is telling you not to come to the village, or some tea garden worker has been tested positive, but the whole village has gone against him. So in that case, they can call up this number and take for legal help. So the idea, I feel, like what we have learned from Darjeeling, is that we need to collaborate and we need to innovate. Innovation is very, very important, like how this particular pandemic has taught us. Even like online meetings, this is what an innovation is all about. We wouldn't have thought it would be possible if the pandemic wasn't here, but it's possible now. We can be in Darjeeling, you can be in Calcutta, somebody can be anywhere, and we can still discuss about the major problems. So this is what we have been doing in this wave. And I've told our foundation as well as the Jesuit fathers that we should be prepared for the third wave, because I think that's where we went wrong. We never thought about the second wave, and that is why we were kind of, our defense level was really low. So now that we know that there will be a third wave, we should really be prepared for it, so that we can handle it better. Thank you so much for listening to me and my experiences from Darjeeling.
Thank you so much, Vikram sir. That was a really, really, really interesting talk. And we are, as you know, we are already in contact with Vikram Foundation to do something similar here in Siliguri. I'm sure there are tons of questions for you, but now, as Tanmoy earlier was saying, that politicians aren't as involved this time, and often these kind of conversations only happen between academics. I think it's, the great thing that IMPRI has done this time is actually bring a politician on board, and let's, to hear what they have to say. We have Shri Rajen Sundas, the Trinamool Congress leader, and also the MLA candidate from Matigara Naxalbari, here to speak with us. Shri Rajen Sundas ji, अगर आप चाहे, आप सुन सकते हैं?
Oh yeah.
Okay.
Over to you, sir. I can help.
Yes, sir. Please free to speak in Bangla also if you feel like.
No. I will speak. हम हिंदी में बात करेंगे.
हाँ, हिंदी में भी ठीक है. No problem. Yes, please.
हाँ. अरे मेरा थोड़ा एक्सपीरियंस है. मैं यहाँ का टी गार्डन में काम किया बहुत दिन से. काम करते करते मैं भी अफेक्टेड हो गया हूँ. तो मेरा जो एक्सपीरियंस है, इसमें जो फर्स्ट वेव था, ये सेकेंड वेव दूसरा तरफ का है. सेकेंड वेव में बहुत गरीब आदमी को, लेबरर लोग को, जितना भी काम कर रहा है यहाँ टी गार्डन में, वो लोग बहुत अफेक्टेड हुआ है। इसीलिए ये सेकेंड वेव बहुत डेंजर है। और हम लोग का जो कमान में जो काम करता है, दे आर नॉट वेरी एजुकेटेड। वो लोग टेस्ट करने भी नहीं चाहता है, और वो लोग ऐसा भी डरता है कि हम लोग टेस्ट करने से कमान बंद हो जाएगा। हाँ, और मैनेजर भी बोलता है सबको टेस्ट करने से कमान बंद हो जाएगा। तो इसीलिए वो लोग बहुत डरता है। इसलिए हम लोग ने एक तो प्लान क्या किया है, ये लोग क्यों डरता है कि ये लोग को जाना पड़ेगा, दे हैव टू गो टू द, जो विक्रम अभी बोला है, दे हैव टू गो टू द डिस्ट्रिक्ट हॉस्पिटल। और हम लोग का यहाँ है नॉर्थ बंगाल में, तो ये लोग बहुत डरता है। इसीलिए हम लोग का वहीं एक तो सेफ होम बनाकर वो लोग को बोलना पड़ेगा, दे आप लोग का बाहर जाना नहीं पड़ेगा। आप लोग जो कोविड पॉजिटिव हुआ है, वो आप लोग का यहीं आपको यहीं बैठना पड़ेगा, यहीं कमान में ट्रीटमेंट हो जाएगा। हम लोग का ये वो लोग का वो करना पड़ेगा, हम लोग का बुझाना पड़ेगा। जैसे आज एक तो हम लोग का यहाँ इंसिडेंट हुआ है, जो तराई है, दिस इज नॉट अ टी गार्डन। तराई में जो जो वो रिवर बेल्ट में काम करता है, वो लोग गरीब आदमी, वो लोग 44 आउट ऑफ 100 44 वो लोग पॉजिटिव हुआ है। और वो लोग हम लोग को हमको बोला है, सर हम क्या करें। हम बोला है वो लोग ठीक है, आप लोग जो है दवाई लेकर आप लोग माने आइसोलेशन होकर बैठ लीजिए। तो हम बोला वो लोग को आप लोग को क्या लगेगा। वो लोग बोला हम लोग का खाना वाना लगेगा ऐसे। तो इसीलिए हम लोग क्या सोच रहे हैं, एक तो सेफ होम हम लोग हम आप लोग को बता दिया, सेफ होम करना पड़ेगा। और विलेज विलेज में एक तो विलेज ग्रुप करना पड़ेगा। तो विलेज ग्रुप करने से क्या होगा कि विलेज ग्रुप करने से वो लोग बोलेगा कि हाँ, विलेज ग्रुप में वो लोग का क्या डिमांड है, क्या लगेगा। हम लोग क्या करता है, हम लोग एनजीओ लोग जाता है, और यहाँ से बहुत आदमी लोग जाता है, और वहाँ विलेज में सब बांट देता है। तो मेरा सजेशन है, वो लोग सभी को नहीं देकर जो जो अफेक्टेड पर्सन है, वो लोग को जो खाने के लिए वो लोग का विलेज विलेज का जो आदमी है वो लोग ही बोलेगा हम लोग का इतना आदमी को खाना लगेगा। जैसे आज आज हम लोग तराई में वो लोग एक तो कमेटी हम बोलाता है, तो कमेटी तुम लोग कमेटी कर लो, तो कमेटी करके तुमको क्या क्या लगेगा वो हम लोग को बता दो। तो वो लोग हमको बोला है हम लोग का खाना लगेगा, ऐसा दवाई लगेगा, ये लगेगा, वो हम लोग प्रोवाइड कर रहा हूँ। ये इसीलिए मेरा जो एक्सपीरियंस है ये सेकेंड वेव में बहुत डेंजर, थोड़ा गरीब आदमी लोग को इफेक्ट हो रहा है। आगे बार ऐसा नहीं हुआ था, हम लोग आगे बार भी काम किया था, ये बार एक गरीब आदमी लोग बहुत इफेक्टेड हुआ है। इसीलिए हम लोग का इस बार सोचना पड़ेगा। जो विक्रम ने अभी बोल रहा था, ये गवर्नमेंट को खाली छोड़ देने से नहीं होगा, हम लोग सब आगे आकर काम करना पड़ेगा, जो गरीब आदमी के लिए। इसीलिए मैं भी ये लोग का साथ काम करते करते इफेक्टेड हो गया हूँ। आज मेरा भी 13 दिन हो गया हूँ। हाँ, मैं भी आइसोलेशन में हूँ। इसलिए मैं बेसी बोलने नहीं सकूंगा, बेसी नहीं बताऊंगा। इसीलिए मैं इतना बोलकर मेरा बात यहीं समाप्त करता हूँ। धन्यवाद।
Thank you so much, Rajen sir. Um, Arjun sir, should we do the presentation or?
We can go to Chandan sir. Chandan sir.
Yeah, no problem. Sir Chandan sir, if you're there, we can over to you, sir.
Kindly unmute. Yes, please, sir. Are you able to hear us, sir?
Hello.
हाँ,
Yes.
वीडियो ऑफ हो गया।
I will coordinate. Yeah.
Yes.
Hello.
Yes, sir. Please go on.
Yes. Good afternoon, everybody. I think you are all well. I was listening the views and experiences of some great personalities present here, and I congratulate them. And I am lucky enough to be a participant in such a huge demanding matter. And really it is contemporary, and I think very fruitful.
Chandan sir? Arjun sir, is it just me?
No, for me as well. I think if Chandan sir can just turn off the video, तब bandwidth थोड़ा मिल सकता है.
हाँ.
Chandan sir, सुनाई दे रहा है आपको?
Hello.
Yes sir.
Chandan
Yes
sir,
sir.
please sir, we can hear you sir. Please go ahead.
Okay.
We can hear you. You can go on. Yes, please.
But during this time, that is second time lockdown, the people are very daring, very much daring, I think, because they don't wear masks, particularly in rural areas. They think that they are past 1 year and nothing has been done. And the mortality rate is only 3% or 2%. They come to know it. But joblessness made them actually daring attitude. That they had their daring attitude because of joblessness. And nowadays, the people have no other alternative but to go to the workplace, but they cannot. And this COVID situation actually leads the people to a hard reality, on ground reality, what we see here. The people were going to the sea as a fisherman, some were going to the Kolkata and the metropolitan city and suburban areas for as maid servants, and many more were engaged as a guest laborers in different states. But they have come and they are bound to stay at their home, having no job. As a result, the early child marriage becomes a rampant, which becomes less than 5% in my locality. I know I have 4,500 students and 5 hostels having 1,000 boarders, and I come to know many more dropout is there, and the situation really grim, pathetic, and we discussed in so many times in so many webinars, and we all agreed to this, that why the people are doing this, because you see they want to less their burden, and that's why early child marriage again becomes a regular matter here in Sundarban areas. And trafficking also is done before this lockdown. Unlock situation and lock situation actually aggravates this situation. This that is trafficking, particularly the girl child trafficking. And the girls need sanitary napkins. We provided them through our networks, that is in 30 villages. We work with a team. Sohang Siddha group is there. So many groups are there, NCC, NSS, and other groups are working in their villages. And another thing is that all have discussed all other things, but I am discussing a separate thing, what I face every day. And what happens here, the online classes, they cannot reach as they have no Android set or no internet connection. Only 10 to 15% join in our online classes, and others cannot. This COVID situation had a grim reality, bringing the difference between the rich and the poor. It makes a sharp difference, and that's why the poor students having brilliance are suffering from inferiority complex, and that's why there are some suicide, there are some hopelessness and other things that we have nothing to do. We cannot read, we cannot go to school, we cannot go to play to our playground, and as a result, such a huge number of dropout will live and continue. If there is no other alternative, if the government does not come with a task force or a high level, forming a high level committee to assess the situation, it will be a very dangerous in the field of education, and they will not come back to their school. And I think so. And we have to do something. If you see, the people are not going to hospitals, or not, hospitals have no beds, no oxygen, and they are some of them are forced to go to the nursing home and they cheat the pocket. And you see, I only 1 week ago, I sent a lady having fever and other symptoms of COVID, and she was treated. Within 4 days, in a rural areas, a nursing home like Joynagar demanded 1 lakh, and she has to sold her land and other materials, ornaments, etc. And how can this experience the villagers share, and that's why they don't want to go. They are suppressing themselves. Ultimately, some of them are actually being killed in their houses, and this is also happening because, as our earlier speaker already told it, that if they come to know, other people will boycott it, and that's a problem. Huge stigma is there, and there are so many other things that we have to combat. But to face the situation, what we are
Binayak?
Yes, sir. I think sir has been cut off, but I think we heard most of what sir was saying, and it really is fascinating to hear about these very grim realities.
yeah.
Yes, sir. Can you please go ahead? Go ahead.
Sir, excuse me.
Please, sir, please go ahead. We can hear you, sir.
We cannot hear to your last 1 minute. So if you can repeat and go on. Yes, please.
Oh, so with
Please unmute, Chandan. Yes, go on.
as a mute spectator, and we are working also in the field with the help of some NGOs. Early child marriage रुकने के लिए we consulted with the IJM, International Justice Mission, and Saji Philip came forward with his team, and all the headmasters of the rural areas and city areas, town areas came with us, and we are combating that. We are making counseling and informing police station, child line, and so many other places, and also the village level committee and the block level child protection committee. We are discussing with them. But there are, the same situation is prevailing, not informing us even. People, other people's neighbors remain silent because they know the actual situation, that parent cannot feed their daughters, they cannot teach their daughters, cannot send their daughters to schools, and there are some psychological problems they crop up. And as a result, they are annoyed, irritated, sometimes that is not comfortable, something like that. The conflict between the daughter and the dad, and so many times it results to leave the house and go with some unknown persons, and as a result, trafficking is being made. Trafficking is being done in this way, and early child marriage also is there. But we are combating. We are with IJM and other social and government organizations. And there is another thing that we are giving some food, cooked food, dry food with assistance of some NGOs and other government and non-government organizations. We are going to them, giving shelter to them in our school, just to relieve from the cyclonic storm which is coming here. And all through day and night we are working. And some volunteers are there, number of people are there, youth are there, who are coming with us, our ex-students, some guardians, some teachers, all are engaged in this respect. And our Mukti, the organization, Sankar is present here. He is also a good friend of mine. The founder president of Mukti always cooperates me, and we are making some oxygen parlors and some interim relief centers in Sundarban areas and other parts of West Bengal with the help of our headmasters. We have a society for headmasters and headmistresses, and they are coming forward. They are taking the responsibility. They are taking the leadership to combat this situation. You know, you see the in tea garden areas, we have our headmasters. The same matter they raised there, what our MLAs have said. And also in some brickfield areas like Murshidabad and other industrial areas like Haldia, they share it. And how to come out from this situation? We need immediate the government's intervention. Hello.
Yes, sir. So we will come to the way forward round, Chandan sir.
Yes, sir. And a patient hearing you paid, and I am grateful to you for calling me here, and all others stay safe in a good health and good mood. Thank you very much. Thank you.
Thank you, Chandan. Binayak, we have Samir sir.
Thank you so much. Yes, sir. Oh, we have.
Yes.
Exactly, and that would be such a wonderful.
I have taken him on the phone because some network issue. So if you can just introduce him, then Samir sir will make his comments.
Yeah, sure. Okay. You know, it's Arjun sir. It's so wonderful that it is Samir sir, because I was just speaking about, you know, how there is this, there is the South Bengal issues that were brought about. There was the North Bengal issues that were brought about, and it's so fitting that we now have Professor Samir Kumar Das, who is a professor at political science in the University of Calcutta, and also the director Institute of Foreign Policy Studies. He was also the vice chancellor of the University of North Bengal, and somebody who was in love with North Bengal. It's really wonderful that we have Professor Samir Kumar Das sir here. Professor Das, it's over to you, sir.
Thank you. I have to begin with a word of apology because I have to make my presentation on phone because there are serious network issues, and since morning we are suffering from power outage. I begin with a word of thanks to IMPRI India, to Dr. Kumar, the director of IMPRI India in particular, for having given me the opportunity of sharing some of my tentative thoughts. I could not listen to some of the important presentations, but I can anticipate that you had some wonderful presentations here, and some churning of thoughts must have occurred here. Let me begin by way of saying that there are two givens when we are referring to rural India, or for that matter, rural Bengal. One is that the health infrastructure is comparatively poor. Comparatively poor meaning that if you compare health infrastructure with health infrastructure of the countryside with that of the urban India, then obviously you know that the health infrastructure is poor. And we have to assume that the health infrastructure cannot be ramped up in the immediate future. So whatever solution we think of must keep this in mind as given. The second is that we are talking about vaccine hesitancy, particularly in urban India. But then if vaccine hesitancy marks urban India, then I would say vaccine aversion is what marks rural India. And on top of it, you have vaccine shortage. So we can't think of full vaccination in the near future. In fact, it's estimated that if this pace of vaccination goes on, then it will take another 5 years, in fact 5+ years, to get the whole of India vaccinated. Now, under the circumstances, what can we do? I will say two things in this context. One is that we have to think of a solution in which, in fact, you are not asking the villagers to go to hospitals. In other words, you catch the villagers before they are seriously infected and they need to be hospitalized. So you need to act in a sufficiently proactive manner so that the infection doesn't turn worse and so that our health infrastructure doesn't get stressed. You have to understand these things. It makes absolutely no sense if you ask the villagers to go immediately to the hospital to buy medicines because they don't have money, they don't have enough hospital beds, they don't have communication, they don't have ambulances. You have to keep all this in mind. So you have to do something immediately, so much so that they don't have to end up in hospitalization. So this is the first thing. The second thing is this, that I will also raise the question that whatever experience I will share, I'm going to share in a few minutes time with you, are actually experiences derived from whatever happened during the first wave. And why is it that Bengal countryside could cope with this infection, this problem, and this disease relatively, reasonably efficiently, I won't say absolutely successfully, but reasonably efficiently during the first wave, which perhaps did not occur during the second wave. And in this context, I would say that we perhaps have to think in terms of social management of the pandemic. In other words, which implies lesser dependence on government facilities, lesser dependence on institutions, lesser dependence on hospitalization, so on and so forth. And what do we learn from our first wave? I will just sort of use 4 sentences and then I will stop. One is what I would describe as disconnection. Because the lockdown was announced early during the first wave, so you know that urban India could completely be disconnected from rural India, with the effect that the urban India, which is otherwise the nursery of infection, could not infect the countryside in the way, for instance, it is infecting and it has been infecting the countryside, particularly, for instance, in rural Bihar or rural Uttar Pradesh during the second wave. So this is the first thing. The disconnection probably is the word. I'm not saying that a total lockdown will do, but perhaps you know that what we have to think in terms is to sort of self-containment of certain villages, certain areas, so much so that you know that it is not in frequent touch and contact with the urban India. The second is what I would describe as identification and enumeration. In other words, because you know that urban India suffers from the vice of anonymity, we don't know who my next door neighbor is, but in the village everyone knows everyone else. So anyone coming from outside, a migrant for instance, can be easily identified. And this is very important because you know that you have to understand that people coming from outside must be kept at a distance and they must be enumerated. Now, I'm telling you that even if you know that the government of India went to the Supreme Court saying that we don't have any data on how many migrants actually had migrated from their workplace back home, you know that the Solicitor General perhaps went to the Supreme Court and said this. But you know that my experience, particularly in the districts of Malda and Murshidabad, Malda is a North Bengal district and Murshidabad is a central North district of West Bengal. And I'm telling this for those who are not quite familiar with West Bengal's map. Now, I know for sure that each village, and particularly the religious place, the masjid or the temple, for instance, has a record of how many people, how many villagers have migrated to which places, and their phone numbers, their mobile numbers. We have worked on some of these villages. So they have the database, and they know for sure that who all are the migrants. So the enumeration problem is solved insofar as the micro villages are concerned. My third pillar for take away from the experience of the first wave is disallowance. In other words, stop them at the doorstep. In other words, whoever comes from outside, you stop them at the doorstep, don't let them in. And you have all different places where quarantine facilities were provided. For instance, it could be a crematorium, a burning hut. For instance, it could be a local panchayat bhavan, a primary school building, so on and so forth. So you know that all these places, and remember that all those quarantine places were set up at the initiative of the villagers. So without the mediation of the government. So that's the beauty of it. And finally, what I would talk about is the fourth pillar was vigilantism. In other words, rural initiatives by voluntary groups, clubs, vigilante groups. Now, I can cite an example, and we have always been talking about, in fact, we have been in communication with Chief Minister at one point of time, arguing that why aren't clubs not mobilized? Local clubs are not mobilized. Now, in sharp contrast to whatever has been happening during pandemic, think of the floods of 1978, the devastating floods of West Bengal. It took place during the autumn. And we know for sure that that was probably the first or the second year of the left front government. It came to power in 1977 with the Janta government in power at the center. Now, the left front government could manage the floods. Why? Because it could mobilize the clubs. It could mobilize the local people, the neighborhood communities. So that's the most important part. It's beyond the competence of the government. And you have to depend on these local initiatives. So what are these clubs doing now? I know for sure that there have been, and many clubs have come forward. They are supplying food. They are supplying everything to everyone else. They have set up, and one example which you can describe as best practice is that in one of the Sundarban villages, they have set up what I would describe as a children's school library. Because you know that many of the migrants, when they came back during the first wave, found out that their children were without schooling, without education. They were left in the lurch. They didn't have money to buy books. They didn't have money to buy cell phones or any device from which they can access the online classes. So what did they do? They set up a library where school textbooks are distributed free and the students can borrow from the library. It's called Gramin Library. I will not name the village because you know that probably it will not be fair to sort of showcase the village, but it's a best practice kind of thing. And the migrants actually raise the money themselves. They set up the library, and finally, you know that the local clubs also exercising surveillance that whoever is falling sick. So why aren't the club buildings not turned into oxygen parlors, for instance? Let us keep 2 or 3 cylinders there so that you can immediately attend to the patients, to the doctors. What are these clubs doing? So that's the most important part. I think that we are not seeing the mobilization of the local clubs, the local voluntary groups, in the way we expect them to see. So thank you very much. Maybe that I will have to sort of take leave and I will not be privy to the kind of discussion that will follow, but maybe that I will have to depend on Dr. Kumar for all the proceedings, and at some point of time, I will expect that all the minutes of the proceedings will reach me, and I will be enriched. Thank you very much.
Professor Das, sir, could you, before you leave, could you just give us time for one question, sir?
Yes, go ahead.
Yes, sir. I mean, because as you said, you would not be privy to the discussions, so I thought it would be a shame to let you go without at least getting more from you, sir. Sir, I was wondering, whatever you were mentioning about the reason why there's a spread of infections in the rural area perhaps perfectly sums up why somebody like Shri Rajen Sundas, as he was mentioning, that he's seeing more cases of COVID coming up in the rural sites. And of course, as you mentioned, and also as Shri Rajen Sundas was mentioning about what he's seeing in his constituency, about how there is a general sort of breakdown of healthcare facilities, especially in these areas. Now, sir, I was wondering if you could just tell us a glimpse about the way forward. So, I mean, what would you suggest as the way forward? What is the one? What is the suggestion you'd give to all the activists who are here, to all the people who are working on ground, sir?
Yes, sir. Let me also add a follow-up question to this, since we are also anticipating the third wave. And sir, you mentioned about the clubs and all, and cyclone and other things. And there was also election, and the voluntary organizations are also very tired because they have been working very hard. And Bengal being the land of Vivekananda, Tagore, also Amar Sen, putting so much of insights into all this. So if you can also add what can be the reinvigorating force to tackle for the third wave. Prasidas, over to you. Yes.
Yeah, I mean, part of your voice was garbled, so I don't think I could hear you correctly. But let me try and answer the questions, if assuming that these were your questions. The first point is that during the first wave, the lockdown was announced very early. Now, our Honorable Prime Minister has been criticized for that, but one good thing was this, that it could cut off the communication system very early, in the sense that urban India, which is otherwise the nursery of infection, could be effectively cut off from rural India. In other words, so countryside was spared that way. You have excellent experiments, not so much from Bengal, but actually from parts of India's northeast, in such states as Nagaland, in Mizoram, and in other places, for instance, where you can see that the urban India was not in touch with rural India. So the countryside was spared, and the villagers were very conscious that they wouldn't let the urban people come in and would infect them. So this was one great thing which had happened at that point of time. But during the second wave, that you have already mentioned that there were some super spreading events, which means that it could spread out, and there was absolutely no restriction on free communication across the urban India and the rural India. So that's the reason probably why the spread has occurred on an unprecedented scale. We never could expect this to have happened. So this is the contrast. Coming to the question of third wave and how we are going to tackle it, I think it's very important. If the government estimates are to be taken seriously, then you will see that 80% of the patients actually don't need hospitalization. And I know for sure that the voluntary groups, the local clubs, are exhausted. But exhausted for what? Many of the clubs simply did not do anything. They were just indoors during this time. What did they do? So why are they exhausted? You have to introspect and ask this question. And I'm not saying that they haven't done anything. But what I will always say is that they could have done more. And if they don't do more, then obviously you know that the government support system will simply not be enough. And I did not say that the government structure has collapsed. What I say is probably that the government structure is inadequate, is ruefully inadequate. But then you know that many of the Bengal, particularly in rural Bengal, you have hospitals, health centers, which are reasonably well equipped, better than, let's say, what you see in Bihar or Uttar Pradesh. That's my primary. If you ask me to support my contention with data, at the moment I won't be able to do that, but probably you know that it's a shade better than whatever you witness in Bihar and Uttar Pradesh. So I would say that catch the COVID patients before they're seriously infected, so much so that they need to be hospitalized. That's my point. We need to act proactively. And who can act proactively? Not you and me, who live in urban India. Only your next door neighbor, only the local club, only the para and local vigilantism. That's my point. So, you know that the local clubs, they can serve as vigilante groups. And I say that if left-front government could do it in 1978, why can't we do it in 2021? And I'm not saying that we have not done anything. I will emphasize on this point. Many of the voluntary groups have done enough. They have been doing a wonderful job, brilliant job, but then we could have done more.
Thank you. Thank you so much, Professor Das. And I will share the proceedings and the video to you shortly.
Sure.
Right.
Sure.
Thank you. Have a nice evening.
Forward to that. Thank you.
Thank you.
Thank
Yes,
you.
Binayak, we can.
Yes, sir.
We can.
I think we, yeah.
Yes, our next panelist, which is you. So I'll bring up the slides.
Yeah, sure.
Yes. So meanwhile, Binayak, you can start that from where you are starting. Yes.
All right. Before, as the slides come up, the issues that Professor Das was talking about, and these are the same issues that sort of what I want to present to you all. And it sort of iterated over and over again as we were speaking, as everybody here was speaking about what we need to do and what kind of problems we are facing in the rural side. And one thing that I think I take even as a moderator of this panel is that there is a need for more decentralization of the COVID relief, of the COVID relief efforts that we need to do. So can we go to the next slide, please? Yeah. You know, the thing is, here in the Matigara Naxalbari side, this is a constituency that has a lot of bagans. This is a very, very rural side. There are only very few, urban sort of clusters, which is basically Naxalbari Bazaar, Bagdogra, and what he calls Shiv Mandir Bazaar, and then Champasari. The rest are very, very rural areas. Now, in a constituency like ours, and I would expand this into what Professor Samir sir was also talking about, in a country like ours, where the administration is highly centralized, right, and certainly does not have enough reach to reach the very, very the last sort of the outposts. It's not a region which is conducive to using the methods that have been used in the West, where there is very robust health infrastructure and a very robust administration. Here, that kind of a top-down model perhaps will not work. We will have to think about other kinds of efforts. It's something that has been expressed in the Bombay model, which is basically a bottom-up approach, right? Which will basically look at the Bagan and the Bagan areas and the paras and what sir was mentioning, the clubs, etc., as the basis of where we will have to sort of center our COVID relief effort. And this is a model that we'd like to call the Matigara Naxalbari bottom-up approach, or rather the village model. So next slide, please. Next slide. No, next. There's a slide after this, sir. Next. Yes, thank you so much. Now, we've decided here is that we have basically divided our effort into 4 stages. The first stage, where we plan to create what is termed as Village Action Committee, which even Sri Rajen Sundas had just spoken about creating committees, right? Which will be dependent on these very basic para village level, or rather, Bagan area centric organizations who will create their own committees, who will then work in conjunctions with the various Samaj clubs, religious organizations, NGOs, etc. Once these VACs are created, then then what will happen is that these VACs will decide what the village, or rather the para, needs, right? Whether it is food, or whether it is somebody who needs to be taken to the hospital, or whether it is sanitization, etc. Often what happens, what we've seen happen here, is that a lot of people, well-intentioned people, they go to these rural areas, take a lot of stuff with them, whether it is masks, or whether it is cooked food, or whether it is rations, etc., and go and distribute. Of course, they take lovely photographs and then put it up on Facebook. But the point is, it's I'm not saying it's not effective, but the problem is whether the right equipment and the right resources are reaching the right people. For example, village A may or may not need masks, but then the people taking the masks to them, they don't really know that. They think masks is something that everybody needs, right? So they take and give the masks to them. Now, it's something they may need, but it might not be at the top of their priority, right? Similarly, cooked food, right? There were various villages here. One of the villages that Sri Rajen Sundas was talking about, which is known as Naya Basti, which is really, really interior. It's near the riverbed. It's a region that's populated by Nepalis. What happened is that village didn't necessarily need cooked food, but they got cooked food, right? When what they really needed at that point of time was sanitization. Now, once a VAC or a village action committee is created, they tell us what they require, right? They tell us whether it's food they require, whether it is sanitization that they require, or whether it is mask, etc., etc. In other words, the village decides for itself what it requires, or is not dependent on the alms or charitable organizations to sort of give whatever they feel or what they are comfortable with giving. The other thing is that we have seen a proliferation of these various philanthropist groups. Some people, there's so many helplines right now in Siliguri, right? Not all of them work, but there are several of them, right? And there are so many various organizations like the Marwadi Yuva Manch. There's the Lions Club. There is several of these clubs doing there's the open kitchens. Some of them are distributing masks. Others are doing what, but there is no organization amongst them. So there is no coordination between them. So what happens is that they at best affect only a small region, right? So what we intend to create is a war room filled with these people who will then coordinate between these various helplines, these various philanthropist groups, etc., etc. Now, where does the VAC and the war room come together? The VAC, the members of the VAC call the war room, and then they tell them that we require this. The war room then goes through all of these various helplines, these various organizations who they are in touch with, and then they get the material that is required by the village and then send the required material to the village. In case it isn't found there, then we, from our own resources that we've been sort of stocking up, will then send it to them, right? In other words, there is coordination between what is required and then what people can provide. The other thing is that, you see, while maintenance, one of the things that apart from what we remember from the first wave of the coronavirus is the kind of lockdown measures that were implemented by the police. You had police beating up people. You had police sort of there was very strong arm measures that were taking place. Right now, this often happens because the police is extremely stretched. Their resources are extremely stretched. Their manpower is extremely stretched, etc., etc. Now, the VACs, the Village Action Committee, will be in charge of maintaining lockdown in their own region. In many ways, doing what Samir Kumar Das sir was also saying, that maintaining the isolation of that particular village, protecting it from the infection coming in from outside. Once, because of the kinship network, see, this is the strength of the region. This is the strength of of the East, kinship networks and the social organization at the grassroots level. Now, because of their kinship networks, information passes very quickly. They would know which house is affected, which house is not affected. Once a house is affected, they would take them and they would take to the isolation center, local isolation center that we were proposing to create in each bagan and in sort of clusters of certain villages, right? Take the infected person to the local isolation center, and then isolate that particular household completely. In other words, decentralize the entire sort of effect. And uh, this is how we've thought of these measures. I'm sure there are a lot of loopholes in this ideas. We have constituted uh, uh, at least three such VAC committees as sort of an experiment, and they worked quite well. Shri Rajen Sundas just mentioned about one particular village that called us today, spoke about how out of 100 houses, 44 houses were infected. These 44 houses have immediately been isolated. The members on, the infected members have been sent to the isolation centers, and the food requirement that they, since they are daily wage earners, they've mentioned that they require certain amount of food grains, etc., etc. We've already packed it up and we are sending it to them. Now, I think this is the best way in which we can work, where we are not dependent on the state entirely. Because as all of you have mentioned, if we are dependent on the state entirely, then it's a major problem. I'm sure there are a lot of problems and a lot of loopholes in these ideas, and I'm sure that we can get a lot of sort of feedback from everybody who's here in this panel. Arjun sir, I think I'll end it here.
Right. Sorry. So Vinayak, why don't we, proceed for that, or just a wrap
Yeah,
up?
I think.
Yeah.
Yeah, I think we have
We
the
can
shifting
move.
between and a moderator. We have
Chandan Mathi sir, we can go first. He has some relief work to also go to. Chandan sir, if you can hear us. Chandan Mathi sir, can you hear us? Yes, please. Kindly unmute yourself, sir.
May
Yes,
I leave? May I leave, sir? Hello?
Yes, sir. In 1-2 minutes, if you want to convey your way forward.
What else I should say?
On the way forward, yes.
I listen to you all, and it is a good discussion. And contemporary, the present situation is very grim, very worse, and we all together can combat it. Definitely, all the clubs, NGOs, the person interest in this regard and volunteers are to be engaged immediately to combat the third phase of this attack of COVID. And we should unitedly work, the central government, the state government, and other government, non-government organizations should come forward. Otherwise, our civilization will be in danger. So if we must have some policies, some task forces are to be engaged, civil defense and other military forces, medical teams. Air Force have their medical teams. The army have their medical teams, and other medical teams are to be engaged, keep ready, and there should be a national policy, state level policy, high level committees to combat this situation. Otherwise, only the hospitals cannot accommodate all the patients. See, our super specialty hospitals in our state, in Kolkata, cannot even accommodate the patients belonging to the city, I mean the urban areas. So rural people, where should they go? There is no bed, no oxygen, and that's why they are forced to keep themselves, as a shelter in their home, and they have no other alternative. And the COVID treatment in private hospital is so costly that it is beyond their reach. And if the government has to take the responsibility for all, and they must come forward, they must engage the clubs and NGOs and others. One more thing is that one of our participants mentioned the rural library. We have made it. One of my student, he has done it. He was studying in Calcutta University. He scored 74% marks in mathematics honors, and he did it. He collected Altab and from other persons like Altab and some local people, and he built it. Built a library helping the rural people, and that is the village named Rana Ghata, Purbo Rana Ghata. That's a colony, and migrants laborers are there from Sundarban, and that's why he was successful in this respect. I guided them, and I am always associated with them. And so many works are there ahead. We'll go forward. We are working here from last 1 year, more than 1 year, and feeding, giving medicines free of cost, giving oxygen free of cost, and other some doctors help and others. So everybody should come forward in this way. Not should be in paper, in Facebook, in WhatsApp, but in reality, they must come. Particularly 70% are covered with the rural areas, and rural areas have no doctors, no medicines, no money. Actually, jobless people are there. And how can they live? How can they survive? One more aspect is there that the cyclone has come, and many of our villages are already flooded, and we have to work for them. And I am leaving now. I'm sorry for that, and excuse me if I am wrong. Thank you very much. Thank you all. Good night.
Thank you, sir.
Yes, Binayak, please go.
Yeah, sorry. Thank you, sir. If we can have more comments on the way forward by if Tanmoy Bhaduri is still with us. Tanmoy?
Yeah, I just
If
add
give
one
us
point.
some-
Just we need more collaborations from all sectors, and we also need a decentralized approach from the state government. And there is a COVID management system for the state government hospitals. And we also need a same type of database for the private hospitals, and their prices should be regulated. And we should know a district-wise private hospitals beds availability. Otherwise, when the patient party call the hospital and they are charging huge amounts, someone says 1 lakh, 2 lakhs during their admission period. So we need a database of the private nursing homes also regarding the bed availabilities and all, like the government hospitals, and collaborations from all sectors of the society.
All right. All right. Thank you so much. Their question answer box below, right next to participants, and because I was removed in between the sort of the meet right now, and it's actually lost to me. Vikram sir, could you take one of the questions from there? I think there's one on education. Question answer section.
Yeah. I've got saying that, do you think there is a religion factor in the whole crisis management? You spoke about the Jesuits.
Yeah.
How about the places where they aren't in the state? I think it's not about the Jesuits, or it's about the heart, the way you do it. Here, I think the Jesuits came up because in Darjeeling, they have a really big contribution towards education. So I feel, they are very much connected to Darjeeling. Like our school is more than 140 years old now. College is going to be 100 years in 2029. So you see, this is the reason I think we need to look at the situation and deal the situation from your heart and use your head. That is where you have to do it with love. It's just not a protocol or it's just not a rules or regulations or guidelines. We need to uh, kind of fight this pandemic in a very human manner, not very technical kind of way. So this is one of the questions I had. I think the anywhere it's also Ramakrishna Mission. They've also opened up a thing. And I think this is where we need to work. And the main idea here is, Vinayak, we need to collaborate and innovate. Innovation is the only way out. We have to fight this because we've never faced this kind of situation. So we have to work it out, and you have to just come out with some new innovations to fight it. That's where I'm looking at.
Those are really, really strong words. We need innovation to fight this kind of situation, which unfortunately is not something that any of us had heard of, or even our, grandparents might have heard of such a problem. Could you also take the other question on education, Vikram sir?
Yeah, what was the question on education?
The question on education is that, if the panelists could shed some light on COVID and education in the rural areas, implication on.
Okay. I think one we have been doing it in Darjeeling is like educating the people, one in the local language, because this is still a very till last year it was still a very foreign kind of disease, where it was only shown on CNN, and it was more like a Chinese kind of virus, but it never kind of affected so much in India. But now it has actually come to the tea gardens, and it's come to the most remotest place. Like I was just talking to a mountaineer, and it has reached Mount Everest also. That is what they say. So you see, it has reached every corner of the world, and for which I think the people need to be educated regarding the COVID protocols, and it has to be done in a very simple, and for which instructions, the medium of instruction, so that they understand, is very, very important. And education, I feel everybody can take instructions now. I don't think the world has come to such things. Like, even if I go to a tea garden, a tea worker would also be having a smartphone and watching maybe a video or maybe. So it's very well connected. So we must use the new media, which is really well connected now. And this message regarding mental health, regarding COVID protocols, regarding stigmatization must reach every corner. So you must again here innovate these messages so that it reaches to the people, so that it educates the people.
Thank you so much, Vikram sir, for answering that question as well. Well, Shankar sir has actually left, as well as Chandan sir, and we pray that you all are safe. Both of them very heroically have gone out, for the relief effort against another disaster that's coming in, which is Cyclone Yas. So we wish them well, but that also means that the number of this panelists here have drastically come down. If I could get Tanmoy again. Tanmoy, you are somebody who's been working in the rural areas. And, there's a question there is there any possibility to request school teachers to keep in touch with parents of children to save some children from child trafficking, child marriage, and permanent dropout? We can't assure schooling right now, given the upcoming third wave threat, but there is a possibility of reassuring parents to bring the children back. I know this is a question probably from Chandan sir, but I'm sure Tanmay, you could take this, please.
Yes, I know in some villages in Nadia district, few NGOs are convincing parents to keep in touch with them. They run some free coaching camps in villages, and they are regularly keep in touch with the parents of the children as the coaching are closed. And regarding the child trafficking and child marriage cases, I recently heard in few districts it is increased, mostly among the marginalized communities, because as these girls are out of school and they have no connection with their friends and everything, they fall in love with someone over the Facebook, Even Purvo Medinipur District Child Protection Officer said in last 1 year, most 80% cases were elopement. And these are not as child trafficking or these are child marriage case, but these girls and the boys have fallen in love with each another, and the girl eloped with the boy. So in last 1 year, most of the children spend times on mobile phones, and there's the chances of falling prey for child trafficking or child marriage. But the children reading in the government schools hardly get access to I mean the up to class 8 children hardly get access to any smartphones to attend online classes. The only thing we are getting, the percentage is 15 to 20% attend online classes. Otherwise, in the rural space, I can assure you in Murshidabad, Malda, Nodia, Paschim Medinipur, Purulia, there is hardly anyone access the online classes.
Thank you so much, Tanmoy. Vikram sir, if trafficking is in the hills, right? And these same things that Tanmoy spoke about in context of Nadia is also a problem that we see in a place like Darjeeling. Would you like to answer this question as well?
Binayak, I had this opportunity. I'm comparing this, not only trafficking, but I don't know whether you know about, even in Nepal, we had gone to this place. It was in 2007-8. We had gone to the Western Nepal, where there is a Tharu tribe.
Yeah.
You see, in Western Nepal, there was a lot of disturbance because of the Maoist attacks. There was a war between the Maoists and army. So a lot of these Maoists, they were internally displaced, and had gone to Kathmandu and settled. And that is where a lot of these dance bars started to come up, So these Maoists started to earn their living through dance bars. Now, what can happen is there is a definite problem of trafficking, but also people have lost their jobs now, and they are coming back to Darjeeling, or maybe people have lost their jobs. So here, people are going to be displacement also. Like maybe we are going to like if it continues, you see like a lot of our kids from here work in malls or bigger hotels or restaurants, and if that happens, that can also lead to another a really dark kind of profession, because people they need to fill their stomach, and they need to earn a living. So this is one of the problems that I see. But definitely your child trafficking is a problem here, and there is a lot of, especially in tea garden areas, people, especially now with, there are these agencies which come up. They trick these tea gardens workers, saying that they take them to Dubai or take them to Bombay, and give them a good job. Instead of giving them a good job, they are trafficked to these red light areas. There have been stories like that. So one thing with this pandemic is that economics, the economy is going to really be affected in the hills. And that's another a huge problem that we are looking at, because most of the people are dependent on private jobs, and most of these kids have gone to bigger cities. So there will be a lot of problem. And last year there was, like someone said, last year a lot of politicians, maybe because of the elections that was due next year, so they had done a lot of work. So, but this year, yes, I have not seen so much, but we really don't have so much of idea what's happening in other states, because this year it has really taken a toll on in the hills also. Last year we were pretty safe, but this time it's really scary. So I think not only trafficking, but even displacement of people from cities to villages or to tea gardens, that could also be a problem in the future.
Thank you so much, Vikram sir and Tanmoy sir. I wonder if we still have Rajen sir around. Rajen, are you still there? Hello. I think we've lost him because there are a lot of questions coming in for him. Yeah, we just got a question on Facebook Live about again, a question for Chandan sir, but since he's not there, I'll have to go to Tanmoy. what is the role of Aganwadis, where especially in the areas that you're working on? Are they effective in combating, problems that we're seeing, especially with regard to education, etc., with the COVID cases?
Is this me?
Yeah, Tanmoy.
Oh, most of the Anganwadis are closed, and they open monthly 1 or 2 days or for the distribution of rice and alus in South Bengal. And I asked ICTS project officer in Nadia district to open their centers, because I use their centers to distribute napkins among adolescent girls, and they have a registrar of adolescent girls. They maintain a register. So in some areas, some districts, some blogs, their Anganwadi workers are working with Ashas also. They are in generating awareness among hesitant communities regarding vaccination. But in overall cases, these overall Anganwadi system is not working in the state, especially in South Bengal. In specific blogs, there are some active ICTS officers, project officers, and they are engaging their ASHA workers. Even in South 24 programs, few days back in Diamond Harbour blogs, BTO told me that if you want to, I have running a campaign in Diamond Harbour blog also regarding the vaccination. He said, if you want someone to engage from my ASHA's team, you can ask me to, I can ask the BMOs to send some ASHAs to your campaign, but I can give you assurance for my Anganwadi workers, because they are not supposed to do any health campaigns regarding COVID.
All right. Again, thank you so much, Tanmay. And I'm sorry, it's going to be Vikram and Tanmay for the next 15 minutes, because it seems the rest have left us. So, Vikram sir, are you okay to take a few more questions?
Yeah, definitely.
Well, there's a question by Pratik Tamam. This is, what kind of differences have you witnessed in the rural areas of Darjeeling regarding knowledge, attitude, and practices related to COVID-19 as compared to last year?
One thing I would like to tell Pratik is this time they are really scared because people are dying, and it's more virulent in the sense that last year we had worked during the when the migrants were coming back, and last year we had about 18,000 migrants that came back from these bigger cities, and there was a lot of government procedures, so there was a registration of migrants, there was quarantine systems, but this time there is absolutely nothing like that. In fact, I feel that both the state and the central government was quite clueless on what was about to happen, and in fact, for us also, as someone who's working with the COVID situation, we did not know about how big this wave is going to be. So this is where I think we lost out. But if we have to compare it to last year, this year people are really scared. They are scared in the sense that because people are dying, and it's more visible. Last year it was, we had only about like one death in Kalimpong, but now we have lost count of how many people have died. In fact, there people have died just when they are about to reach the hospital, so they have not been even tested. Some have died at their homes, finding it difficult to breathe. Also, another problem is, this if there is a COVID death, people refuse to even acknowledge it is a COVID death.
Yeah.
And this, in fact, leads to more the spreading of virus, because we need to be things. So this year, I think that is one of the things that are there, is that people are a little conscious. Like, for example, for funerals and these things, we see very less people going to this. So one thing is, people are aware. People know that this the second wave is more dangerous. The viral load is much higher than the first one, and I think people are a little conscious. But again, people need to come out for their bread and butter. So that is why I think the crowd is still there. It's not a full lockdown, not a curfew, but people are kind of responding to the lockdown that is being called by the government.
You know, I'll give both of you a break for a second, because the question has been asked to Sri Sundas. I'm pretty sure it's to Rajen Sundas, but since you haven't mentioned which Sundas, so I'll take this question for you and give the other two panelists a bit of a break. And the question is the role of political parties during elections or the rise of cases. Uh, you know, it well, the person who's asked is anonymous. So, you know, to anonymous, it would be a little, it's impossible to say that the elections were not responsible for this level of rise of cases, especially in Bengal. But then even before cases began in Bengal, you already had Delhi that was reeling under the massive rise of cases, which didn't have an election. So I don't think it's necessarily. I mean, it's impossible to say that elections uh, uh, weren't a reason or a factor in the spread of cases, but it's not the only factor. But the problem also, was exaggerated because of the fact that the elections happened in 8 phases. You had, Madam Mamata Banerjee requesting the EC to sort of short it, to make it shorten it down to about one or especially in the last phase, down to about 1 or 2 phases. But the EC did not agree to that, and it went on for the whole distance of 8 phases, and that probably played a role in it as well. So yeah, so elections. I mean, it's impossible to state that it wasn't a factor. It was probably a very big factor. Um, so yeah, now that the break for Tanmoy and Vikram is over, there's a question for Tanmoy. Tanmoy sir, please tell us a bit about vaccination plans for rural areas, especially for the vulnerable communities. Tanmoy.
People are scared about the vaccination first thing, because people are saying that if you get the jab, you will experience fever, headache. So I visited Diamond Harbour block, which is in South 24 Parganas, and there is 60% was a Muslim community, and they are ignorant about the vaccination process. And initially, no one interested to take vaccines, and after the second wave, in the around early May, and people started taking vaccines, and they are not registering their names on the app, or they are not accessing websites. They have no idea about it, and hardly anyone in the family possesses any smartphone, and then don't care about it. And the next morning, from the 6 a.m., they started overcrowding this publication center, and there are around 600 to 700 people standing there. And from 10 a.m., the vaccination will start, and only 80 to 120 people will get vaccinated, and rest of the people are overcrowding this place. Every day, this thing is happening there. And now I heard the Panchayat Pradhan is making a list of the peoples of his own party, and sending their name to the vaccination centers. I spoke to the BMOH, and he said, no, I have no idea about this, what is happening there. So this is the case everywhere. Initially, there was no vaccine, and when we have some stock in the rural area, and now powerful people are manipulating. They are sending their peoples to, first they are making list of the ruling party's member and all.
Thank you, Tanmoy. Tanmoy sir, thank you so much. Please go ahead.
Even as a freelancer, I did not get any vaccines, because even the press club organized a vaccination drive, and we went there, and press club also vaccinated their members, not a freelancer. So everyone.
No, even I got a notification from my university saying, "Have you been vaccinated?" So my answer was no, but I didn't get a response. Did you get?
I have an issue here, Binayak. So, I've been really raising this issue up with the DM also, that tea is a continuous product, right? So tea, they have put it in essential commodity. So even as like professors are under lockdown, we are doing classes from home, and the shops are closed, the offices are closed, but the tea garden people are still going and plucking tea because it is an essential product. So every day we have, there is a priority list which the government is following. So right now it is teachers, I think. So Vinayak and all of us also are put in this group. So yesterday there was these hawkers and media people and transport people. They have got their vaccine. Media also there was a problem because they said only accredited journalists, and there is very few accredited journalists. Now there are more freelancer journalists than accredited journalists. But my question to the government is, why isn't the tea garden workers God help us, we will not be able to stop this pandemic, because the rural belts, the infrastructure is really, really bad. And, it'll be a mess. So the government must look into this, must appeal. We have appealed to the government. Even the tea garden owners, they should take this up seriously. I think even Rajen uncle does this in in the Tarai belt. They have not got the tea garden. They have not got their shots as of now. But in that priority list, we have transgenders, sex workers, we have lawyers, we have got everybody else, other than the ones who are open. So I think that way the policy somehow there is something like, on ground there is something, and on the policy in the table there is something else. So this also should be a major concern for us, and I think through these forums, vaccination for tea garden workers should be taken as priority. I think that is where I want to say.
All right. That's actually a very, very important point, and that's something that I think we should really raise, especially with regard to the tea garden workers. You're absolutely right. It's something that Sri Rajan Sundas was also talking about a while ago, about the management's discomfort with having everybody tested. Anyway, there is a question that I probably we probably need to sort of head towards the end, because the questions are keep coming in, and I'm not sure how long we can continue. But there's a question that I think both of you could take, which is by Pratik Tamang, which is, what kind of measures should be adopted to accommodate patients with an already outlined medical condition who requires constant medical supervision and hospitalization? What kind of alternate care standards be provided to them, keeping in mind that they don't get affected, who are more susceptible to COVID-19? Tanmay, if you can begin, and then Vikram sir can take it up.
It is a more medical question.
And we don't. And
there is no infrastructure at all, na? There is no infrastructure in districts. And even after Trinamool government, after 10 years, now we are realizing that there are super specialty hospitals in districts in the name, but there is no ICU beds. There are scarcity of oxygens in districts. There is
absolutely,
lack of infrastructure.
Yeah, absolutely. Vikram sir, would you like to?
I have got this one mantra saying health is wealth now. So we need to be, for those people who have not got any comorbidity, it's best time to just go out and exercise, and you need to be fit. So it is survival of the fittest, like that. That is what is going to happen now. And those people who have got comorbidity, sadly, they have to be isolated, and they have to even be very careful. Even I have seen like many cases where people come out of COVID, but they die. They have they are not normal, as in many get like heart attack, and the blood sugar level really goes up. And although it's a very medical kind of thing, but I think people who have got this comorbidity, there should be also like a post-COVID place. Like we have a pre-hospital, which is like a safe home, but now government also needs to think about a post-COVID kind of place where people can recover. So here it's like with high protein food or with exercise, or with planned diet, they kind of recover and they come back uh, to their normal lifestyle. So I think this is also very important, a post-COVID health and center, something like this.
And that's a really, really good suggestion, and something that can only come from somebody who's been actually working on the field and not theorizing inside an office. Well, I think we would now have to sort of we'll have to end the discussion. I know there are a lot of questions here that are yet not answered. There were a lot of questions for Shri Rajen Sundas that unfortunately is not there to take. He'll probably take it and then he can respond via Arjun sir. I think that's a possibility. Now, since Professor Soumyadip Chattopadhyay sir is not here, who was supposed to be the discussant, I will have to give the concluding remarks. And my this I will not take any longer time. I'm sure both Tanmoy sir and Vikram sir are quite exhausted after taking the questions for the other people as well. Uh, it seems that what we've all heard today is about how there is in the second wave there is a massive amount of infection, especially in the rural side where the healthcare system was already quite weak, right? And the other thing that and that has and why it's so was very nicely theorized and summarized by Professor Samir Das. And the other thing is that the state government or state in itself will not be able to tackle this by themselves, especially in a region like ours, right? Where we need, as Bikram sir has continuously said, we need to innovate and we need to keep thinking on our feet, where we need the help of independent journalists and independent NGOs and paras and clubs and etc., people that are represented by Convoy, right? So for me personally, this has been an extremely engaging panel. This is a panel where we journalists, where we've had social workers, social activists, where we've had professors, and where we've had a politician. And it's from forums like these that we can get in touch with one another and evolve an even more streamlined and a very, very effective plan to fight back against COVID. And not just against COVID, but as Bikram sir has rightly pointed out, even for the post-COVID recovery. And with that, I think I would like to end here with that. And over to you, Simi, for your vote of thanks.
Yes, thank you. Thank you very much, Binayak. And it was, I just couldn't move out it was really, really thoroughly enriching session by the eminent panelists, as you have mentioned, and all of you joining from West Bengal to talk about what your experiences have been and how you're tackling the second wave. And then amid the second wave, there is another challenge of the cyclone. So you're all there on the ground and you have been so thorough with your discussions, especially with, also engaging with the question and answers here on Zoom and also on Facebook Live. I must congratulate even the audience for posing such important questions. And I am sure you agree with me when the questions on vaccination, on the role of rural communities, role of civil society actors, all of these come in the forefront. So I am so grateful and I'm so delighted that this was a huge success. And thank you very much to all the panelists. And I would like to formally propose the vote of thanks on behalf of the Center for Habitat, Urban and Regional Studies, IMPRI Impact and Policy Research Institute. Our eminent panelists for the day, Mr. Sankar Halder sir, founder president Mukti, Mr. Chandan Kumar Maiti sir, General Secretary Advanced Society for Headmasters and Headmistresses, West Bengal, Tanmoy Bhaduri sir, independent journalist and development communication expert, Dr. Vikram Rai, assistant professor from St. Joseph's College and founder of Vikram Foundation, Shri Rajen Sundas sir, member MLA candidate from Congress, Matigara Naxalbari constituency, Darjeeling, and Professor Samir Kumar Das, Professor of Political Science and Director of the Institute of Foreign Policy Studies, University of Calcutta. And of course, our moderator for the session, Dr. Binayak Sundas, who is Assistant Professor at Center for Himalayan Studies, University of North Bengal, Siliguri, Darjeeling. So thank you very much. And it was very, very enlightening. And we'll be sharing the report. And also I thank our presentation team, Manuswini, Mahima, and also our team here at IMPRI. So thank you so much. And I wish you all please be safe and take care. And I hope for further deliberations on this again in future. Thank you. And it was really pleasure listening to all your insights. Thank you so much. Thank you, Binayak.
Thank you.
Vikram sir.
Thank you.
Thank you. Thank you.
Please take care and have a nice
Take
day.
care. Bye-bye.
Yeah.
Bye.